we have ordered vaccines, and we have made it clear also, we have got the protocol that we are going to use to ensure that we start with the healthcare workers, because those are the first line. As soon as the first line workers, and the first line include even people like the police, the healthcare workers, the teachers who are in schools, students and so on. So we have got a system which we have issued that to indicate who will be first to be offered the vaccines. And it is important for us to use that word, the operative term being offered. There is no mandatory vaccination of anybody. It is people who will wish to do so. I think it is also important for me to mention, Grace, that even as you talk about the Oxford-Astrazeneca vaccine, we are also negotiating with the others as well, including the Sinopharm in China. We are looking at the Pfizer's. We are looking at all the other vaccines that have been approved within the World Health Organization, so that we will not be relying only on one type of vaccine.